Vaccination is not new to Jamaica. The fears of vaccination, I believe, especially given the situation with this pandemic, are to a large degree unfounded because we have our own history to rely on. And indeed, with new births in the island, it is our public health requirement that they are vaccinated for various diseases. And that goes on almost on a daily basis. And we do go back to the clinics for vaccination for booster shots.
This is a disease that we have to take seriously. Many people, it is true, luckily, the majority of persons who get COVID may have some symptoms, some have no symptoms at all, especially if you're young. But if you are older, then as many as 1 out of 6 who gets COVID, who is over 70 years of age, is likely to die. And if you're over 80 years of age, then 1 out of 4 may die. So our best hope to control this epidemic is the vaccine. Now, I have the privilege of being on the World Health Organization working group that is reviewing all the vaccines that have been prepared to protect people against COVID. We've looked at this vaccine, the AstraZeneca vaccine. The World Health Organization has approved it as highly effective and safe.
If I take the vaccine, then I personally am safe from the disease. But if I'm the only one that takes the vaccine, it doesn't really do any public good because the disease, the virus is still around and still infecting. And indeed, though I am vaccinated and I may not get ill, I could still carry the virus. This is the beginning of the end. It is not the end. We are right there now, where if we behave responsibly, personally responsible, and as a community responsible, then we can bring the end of this pandemic earlier. A few things that we have to understand. One, it is the scarcity of the supply. Once you introduce pricing as a means of rationing how the vaccine is distributed, then what it means is that people who can afford the price will get it, and those who can't won't. And that is not good for social stability. The second issue is to ensure proper regulation, right? We need to be able, with certainty, that the persons, that we have captured the information of the persons who got the vaccine, and be able at very short notice with, if anything went wrong, especially in terms of the batches and how they are distributed. So tracking is important.
We're asking that the country, all of our people, support us. When it's time to be vaccinated, let's do it in the orderly manner that we can. Let's make ourselves, our entire country, proud of just us accepting the vaccine and doing it the way we know we should. And remember, we're trying our very best to ensure that no one is left behind.